Hello everyone, and thanks for watching. This is your 5-minute edge on how to serve the whole child and whole family. This video was made possible through a partnership between the Wisconsin After School Network and the Wisconsin Department of Children and Families. I'm Jenny Meldy, Director of Community Outreach with the La Crosse Area Family YMCA. I am very excited to talk to you today about the social determinants of health and why they matter to youth-serving organizations. You may be wondering, what are the social determinants of health? Social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life, outcomes, and risks. The social determinants of health can be grouped into 5 main categories: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Social determinants of health have a major impact on people's health, well-being, and quality of life. Examples of social determinants of health include safe housing and neighborhoods, racism, discrimination, and violence, education, job opportunities, and income, polluted air and water, and language and literacy skills. Social determinants of health also contribute to wide health disparities and inequities in our communities. For example, someone who doesn't have access to a grocery store with healthy foods is much less likely to have good nutrition. That raises their risk of health conditions like heart disease, diabetes, and obesity, and even lowers their life expectancy relative to people who have access to a healthy grocery store with healthy foods. It's clear that social determinants of health have a large impact on the community as a whole, but you might be wondering how the social determinants of health matter to your local youth-serving organizations. The social determinants of health that most impact youth include poverty, unequal access to health care, poor environmental conditions, and educational inequities. Children living in poverty and minority children have more health concerns and less access to health care than their higher socioeconomic status counterparts. Having more health problems leads to more absenteeism in school, which in turn can affect academic achievement. You may be wondering what you can do to help break this cycle. When you think about what your program can do to help, the first step is to identify which youth may be most vulnerable to these educational inequalities by looking for signs such as inconsistent attendance, variations in behavior, or expressing worries related to their mental health. Once you've identified children that may need a little more support, you can connect the child and their family with the appropriate resources and assistance. For example, providing food access to a family struggling with food insecurity, or providing bus passes to eliminate transportation barriers. We can also reduce disparity by building more enrichment activities into schedules, adding things like cooking classes, knitting club, or dance to the day allows participants more opportunities to participate in activities that may not otherwise be available to them. You may also arrange your program as a community hub where you partner with local health organizations to come on site to provide checkups or immunizations to students to improve physical health. Knowing what your kids are going through enables you to be intentional in how to serve and meet their needs.